Okay, well, a pivotal vote on health care legislation is on hold until budget analysts come up with a final price tag for the Senate Finance Committee bill. Now, that could come today. Bloomberg's Peter Cook is in Washington with more, and he's standing by with former Medicare Administrator Mark McClellan. Peter?
Betty, thanks very much. He's a doctor, an economist, a former FDA commissioner, former Medicare administrator. Now, Mark McClellan is also a Bloomberg contributor, helping us sort through the health care debate. Mark, as always, appreciate it. It is
good to be back.
Another big week for the health care debate. CBO, the score for this Baucus bill, this changed Baucus bill, comes perhaps as early as today. How important is this price tag, and what do you think it's going to be?
It's, first of all, important for CBO to get this estimate out. Right now, the Senate is in hurry-up-and-wait mode. They've got the committee bill finished. They're waiting for this score. It could be as late as end of the week or early next week. CBO has been overwhelmed with all the work on health care reform. The cost of the bill is going to be higher than it was originally when Senator Baucus proposed it at around $800 billion. Big question is how much higher? Could be $100 billion, could be more.
$900 billion has always been the target from President Obama. If this thing comes in above $900 billion, what happens?
That's a good question. My expectation is the committee is going to go ahead and try to pass the legislation, but the higher the price tag gets, Peter, the more difficult it is to keep all of the members on board.
All right, let me ask you about some of the changes they did in the committee, because again, it's changed not only the price but the framework for this legislation. Every little change here affects some of the balance of power. What are the most significant changes you see in this bill, and what does that mean for the chances for final passage?
The bill eased up on people's health care costs in a number of ways, but all of those ways tend to make it harder for the whole reform package to fit together. One important change was lowering the penalties for people who don't buy insurance on their own. That seems like a good thing. You pay less out of pocket if you don't think you can afford insurance, but if we get fewer people into coverage, that means higher costs for those who are in coverage. That means higher costs for the program and less insurance overall. The bill also increased subsidies for people who do buy insurance. That's a good thing if you're buying insurance, but it does mean a higher overall cost for the bill. There are some other changes that moved in the same direction. Higher cost, fewer people probably participating, and CBO is the official arbiter of what the overall impact of those changes will be.
And those changes are very important to all these side deals with the various industry groups as well. Hospitals, for example, they signed up to $150 billion in cost cuts over 10 years, but if they don't have as many people signed up for health insurance, then that deal's off?
It could have an impact. Most affected will be the insurance industry, though, because if they get less participation, if their costs are higher, they are very concerned that the bill, when enacted, will lead to further changes because this approach won't be working out well. It won't be getting all Americans coverage. It will be leading to higher costs than they had originally expected.
Who are the senators that you're watching most closely now to see if they actually support the bill? Because it's not clear that they actually have the votes.
It's not clear that they have the votes. Senator Rockefeller, Senator Wyden are the most important question marks on the Democratic side. There's still some chance, though doubtful, that Senator Snowe on the Republican side might vote for the bill as well.